Serotonin syndrome. Hi, today I'm going over serotonin syndrome and its potential problems, from diagnosis to causes and how to treat serotonin syndrome. Now, I'm not a doctor, although I have practiced alternative therapy and hypnotherapy for over 20 years. I have to give the medical disclaimer: this video is for educational purposes only and not to give medical advice. You should always seek your own medical professional advice. So with this out of the way, let's find out what serotonin syndrome is all about. Also, if you are the opposite and suffer with a depleted serotonin level, then check out my video on depletion of serotonin. Natural cures, depression, anxiety gone solution. Okay, so an overview of serotonin syndrome. You see, serotonin syndrome is when you take a drug that causes a reaction within your body. This then causes an increase in the chemical release of serotonin to really excessive high levels. Although we need serotonin as the happy hormone chemical, as it is often referred to, too much of a good thing really can be just that, with serotonin that is. So, what is serotonin in the first place? We need to find out what it is. You see, serotonin is the main neurotransmitter responsible for controlling your mood, your sleep and the appetite. So your brain nerve cells need this to function, but too much serotonin is a problem. And we don't want to have this problem, because you see, we need to look at the causes, the signs and symptoms, because these can range from mild shivering and diarrhea to severe muscle rigidity, fever and seizures. Severe serotonin syndrome can cause death if not treated. It really can be that serious. So do not leave it just to go away. So, you see, we need to look at how it actually happens in the first place. You see, serotonin syndrome can happen when you increase a dose of your existing medication, or you begin taking a new drug. It's usually, though, when you combine medications that already contain some serotonin. These could be medications for migraine or an antidepressant. For example, if you take a drug that contains the word triptan in the name, then you're already getting some additional serotonin from this medication, which is okay, it's been prescribed. But if you take too much or increase the dose, it can tip the balance. Some of the illegal substances and drugs, as well as diet supplements, these can also tip the balance with serotonin syndrome. So always check with your own doctor and let them know. Always let them know other medications that you're taking, whether they're herbal remedies or over-the-counter medications that you're taking. Let your own doctor or healthcare professional know. Now, is it always serious serotonin syndrome? Well, it can really have milder forms. You see, which we probably won't even notice a lot of times, but serotonin syndrome, which it can go away on its own without medical intervention. However, if you suspect or feel something different in yourself, do not leave or anything, seek medical advice. Although as soon as you stop taking the medication that is identified as the cause of your serotonin syndrome, that's the one that's caused it in the first place, then the symptoms will usually go away within a couple of days stopping the medication. So, it's now to look at what are the symptoms of serotonin syndrome. Serotonin syndrome symptoms can happen really quickly and usually occur within a couple of hours of increasing a dose of drug that you happen to be on, that something that you're already taking, or if you just started a new drug. Any reaction anyway to any drug, you should go straight back to your healthcare professional. The list of symptoms, though, is quite extensive and can include some or several of these: agitation or restlessness, insomnia, confusion, rapid heart rate and high blood pressure, dilated pupils, loss of muscle coordination or twitching muscles, high blood pressure, muscle rigidity, extensive sweating, diarrhea, headache, shivering, goosebumps. So there's quite a number of things that are not so pleasant there. So looking though at severe serotonin syndrome symptoms, and you may experience, I will say these can be life-threatening, so do not leave to go away. These signs include high fever, tremors. If you experience a seizure or seizures, you develop or experience an irregular heartbeat, you become unconscious, then obviously you need to have medical professional help immediately. If you think or suspect you might have serotonin syndrome after you've started a new medication or you've increased your dose of an existing medication that you're already taking, call your medical professional straight away. Do not delay or go to the nearest hospital emergency centre. It really can be that serious and you can deteriorate so quickly, so do not leave it. So what is the purpose then of serotonin in the body in the first place? Well, first, why excessive amounts of serotonin in the body creates these symptoms of serotonin syndrome. You see, because we need serotonin, we need to have some serotonin in our bodies. We would not function well without any. Typically, your nerve cells in the brain and spinal cord can produce serotonin. This helps in the regulation of our attention, behaviour and our body's temperature. Other nerve cells in the body come into play as well, mainly in the intestines. These can also produce serotonin, because serotonin also plays a part in the regulation of the digestive system and our blood flow as well as breathing. So you see, it's a major hormone or chemical messenger, to be more precise. Whichever way you want to describe it, it is vital to function. Helped by serotonin, we need this, but we don't need excessive amounts of it. Onset of serotonin syndrome, although it is possible that taking just one drug that increases serotonin levels can cause you serotonin syndrome, the condition usually occurs most often when people combine certain medications together. As an example, if you take an antidepressant and then take a migraine medication, or you take your antidepressant with opioid-based pain relief medication, these can increase the levels too much and upset the balance. Another cause of serotonin syndrome, though, is unfortunately intentional overdose, overdose of antidepressant medications. Now, this is a real serious increasing problem, overdosing in many countries, but particularly in the USA. And this figure actually staggered me. In 2021, the figure was every day 269 people took an overdose and lost their lives to intentional overdose. It's absolutely staggering. In 1 year, 105,800 people. Now when I was researching this figure, it as I said, it staggered and it surprised me, you see, because the states in the US that have the highest death rates through overdoses are Florida and California. California being number one. Now you see, we all think in other countries around the world how glamorous and wonderful life must be in these sunny, perceived happy places. So the question I have is why? It does baffle me. If someone lives in these areas or knows why, I'd love to be enlightened if you put something in the comments, because I'd love to appreciate this. As a natural therapist and hypnotherapist, I always like to understand things, and I'm a bit confused on this one. So, on this point though, to overdosing as well, the alarming thing I did see researching is really the levels are increasing massively year on year. This is globally, but especially in America. Now, these figures do not all relate to serotonin syndrome, don't get me wrong, but is a big part of the alarming problem itself. Okay then, to finish off and summarise. You see, serotonin syndrome, although in most cases serotonin syndrome is not a life-threatening condition, It can become one if left unchecked. You are at an increased risk of serotonin syndrome if you recently started taking or increase the dose of a medication that is known to increase serotonin levels. I've put the list in the description of drugs that can do this and cause serotonin syndrome, so you can check on this list yourself, as well as a link to the research sources for this video, because I always believe that anything on YouTube needs to be validated. I only work off research, verifiable research, that is. So if you take a combination of medications that are known to increase serotonin levels, this is the most common reason for serotonin syndrome. If you take herbal supplements, some can really affect levels. St. John's wort, for example, is one of them that is not good at all for the imbalance or creating this imbalance with your serotonin levels. If you use an illicit drug known to increase serotonin levels, why would you do this? But most importantly, you need to get some help, or if you know somebody like this, they need to be helped like now. So you see, the condition is more than avoidable. It really shouldn't be happening, but does, and unfortunately many can suffer the most extreme outcome of serotonin syndrome. It can be deadly serious, but needn't be. So if you've gained something or found it useful, this video, please like and subscribe for more health related topics, and give the bell a little tinkle for notifications. So I'm always doing videos, and I hope I explain things, I won't say simply as though I'm insulting your intelligence, but sometimes I think some of these videos go, they're trying to impress themselves with all the technical words and knowledge that they use. So I will see you in the next video. Have a look in the description. There's always some freebies in there as well, useful ones. So for now, I wish you all good health and take care. Bye bye for now from me, David H. See you.